Streams of data flow through our complex hospital systems.
Anywhere where we need to close a loop or fill a hole, we can do so before the patient leaves instead of doing a retrospective chart review and just reporting on it afterwards.
Next on Health Tech Today, we take a look at the IT solution that frees data from silos and transforms it into actionable information. St. Joseph Healthcare System is a conglomeration of facilities serving a diverse population in California, West Texas, and eastern New Mexico. Over 24,000 employees work in its 14 acute care hospitals, home health agencies, hospice care, outpatient services, and community clinics. The challenge of coordinating data across such a large and complex system is daunting. Inputting, aggregating, and accessing data in a seamless way is the key to delivering the best and safest care. Recently, I was at the Connected Health Conference in Chicago, where I got a chance to talk with the Director of Data Warehousing for St. Joseph's Health System, Kim Jackson. Let's take a look at what Kim had to say. You're using some amazing technology, we call it Microsoft Amalga, to bring all that information together and surface it so that people can actually use it.
Amalga is a great opportunity for us to have a warehousing solution where we can aggregate all of that data and have an enterprise solution where we can do analytics as well as have a system-wide view of the data that we have.
And so often when we think about data analytics or gaining wisdom from this data, a lot of times we're operating on data that's old or antiquated. It's been in the system for a long time. Reports look back, but they're not real time. With the system you have in place, it can be much more real time. Is that correct?
We really want to go from a retrospective model to an area where we can proactively stop mistakes that happen or really close the loop. So when we go live with nursing documentation, we'll be able to use those clues where nurses document in the chart for us to react very quickly and say, let's stop a pressure ulcer before it happens. Let's make sure that we give the medication on time. Not only doing those indicators to prioritize those patients, but to really close the loop to make sure that we give the care that's appropriate.
Now, with so many hospitals and so many clinics all tied together on this system and the sharing of data, obviously one would be concerned about privacy and security of that data. How are you handling that?
We have implemented a security model that takes all of those things in consideration. We have roles-based access, which means staff members get access to data based on where they're located, based on their patients, so that we only view patients where they actually need access. A physician, in fact, will only see the patients that they're related to, so even at the physician level, we make sure that we have appropriate patient access.
Now, I heard that you have a new project that's kind of interesting and exciting called eBabyBooks. Tell me a little bit about that one.
That is a great story, and it's personal to my heart. I'm a mother of 3, and when I had my babies, it's a very exciting time, and you have lots of information you need about the babies. Our eBabyBook is where we attach Amalga to Health Vault, so that when a new mother comes into the hospital, a pregnant mother-to-be comes into the hospital, she will have her baby, and when she leaves, we sign them up to Health Vault, and we push their entire birth record with them so that they can have, at the very beginning, a birth to death electronic record, and we're really excited about that. We've been live for approximately 3 weeks. We've had great interest and lots of accounts already started, so those new babies are already in Health Vault.
Well, Kim, you've been an early adopter for our Amalga Health Solutions. You're doing a lot of exciting things at St. Joseph's. As you look ahead, what kinds of things excite you?
I'm really excited about a lot of the things that we're doing, and I really think we're at the precipice of making change. Now that we have more data together, we can really close the loop, and we can make sure that they get their medicine on time, that their weights have been taken, and that the physician sees all of the information on time, and anywhere where we need to close a loop or fill a hole, we can do so before the patient leaves instead of doing a retrospective chart review and just reporting on it afterwards.
That's really exciting, not only for patient safety, but also for the quality of care that you're able to deliver to your patients. So, Kim Jackson from St. Joseph Health System, thanks for joining us at the Connected Health Conference and at Health Tech Today. Appreciate you being on the show.
Thank you for having me.
On behalf of Microsoft's Worldwide Health, our staff and sponsors, I'd like to thank you for joining us. You know, we're always interested in hearing your feedback. We'll see you next time for another episode of Health Tech Today.
For more thoughts, comments, news and reflections on healthcare IT, join Dr. Bill Krauts on Health Blog.